Clay.
Stephen, I'll let you say a thing now and then I'll continue. Okay. Public comments, here's how it'll work. Once we open it up for public comments, we'd like to give everyone 5 minutes to provide a comment so that we can get through everyone as efficiently as possible.
Can you email the PowerPoint so that people who don't have the bandwidth can review it while it's being discussed?
I don't know that we could email it to everyone who's on the phone. Are you on the phone, Stephen?
Yeah, I am.
Well, we have your email address, so we can send it to you. If someone else is on the phone and would like it, if you could shoot Corey Chase an email, it's Corey, C-O-R-E-Y .chase, C-H-A-S-E @vermont.gov. Requesting a copy of the presentation. And Corey, if you could send, or Alex, send the presentation to Stephen, that would be helpful. So when we open up for public comment, we will provide 5 minutes for each participant who wishes to speak, and we'll have an order for participants to go in. If you have a burning desire to say more at the conclusion of your 5 minutes, please stand down and we'll try to fit you in at the end of this presentation, at the end of the public comment period, if there's time remaining. If it's better, you can always follow up in writing. Comments given to us in writing are very helpful. That allows us to take a look at your comments more closely. We'll also have another hearing on December 8th, so you're welcome to attend that hearing as well and provide additional comment. We're here today to discuss the merits of this plan. So we're looking for your substantive comments on the plan. If you're not speaking, we will be keeping you on mute. When it's your turn to speak, if you could unmute yourself to speak. When you're not speaking, please make sure you're on mute, just so we don't interrupt others who are giving their comment. Speakers are going to go in the following order. We're going to start with those folks who've joined by video first. If you have joined by video and you'd like to speak, once we open it up for public comment, please use the raise your hand feature. It's a little hand at the top of the interface here on the toolbar menu. That will let us know that you want to speak, and we'll go in order down the list, making sure we get everyone who's joined by video. At that point, we will start with folks who've called in but have emailed their desire to provide a comment. If you've emailed us already, I know there's a few people who have, that's great. If you haven't emailed us and you would like to give a comment, please shoot Corey Chase an email now. Again, that's Corey, C-O-R-E-Y .chase, C-H-A-S-E @vermont.gov. And we will call you to speak. If you're on the phone and you want to speak, you'll have to unmute yourself by pressing *6. So when it is your turn to speak, make sure you press *6. And then you will be unmuted and ready to go. At the conclusion of the list of folks who've emailed us, we will open up the floor to people who have called in but are unable or haven't emailed us. I imagine this will be a chaotic time for the public hearing, so please bear with us as we try to get you situated so you can get your comment to us. But those folks will go last. And I'll quickly go over that again after Mr. Dunn has given his presentation. So without further ado, I'll turn it over to Matt Dunn.
Thank you, Clay, for that introduction. And I'm going to do some sharing of the screen. Clay, is that visible?
We see you. I don't see
You don't see the share
presentation.
Okay.
Yeah.
Let me give it one more try.
Just make sure you're able to present.
Open.
Now we see it.
Excellent.
And I just want to clarify, Teams has helpfully sent me another message saying, be sure to let everyone know you're being recorded. So this is being recorded, and when you give your public comment, it will be recorded, and we will make that available on our website.
Great. Clay, thank you for the introduction and the opportunity to be able to share the preliminary findings and recommendations as a part of this project. I'm going to move rapidly through this because the assumption is that people have had the chance to take a look at the actual narrative of the plan, but we felt it was important to provide a presentation to helpfully provide a little bit further context along the way. So to begin with, want to be super clear about the scope of this particular project. And we were asked to look at the immediate ways that the state could address the pandemic needs associated with telecommunications. So there were some other additional pieces that were in the scope of work, but all of them we felt by the RFP needed to be addressed to immediate needs as well as ones that were related to COVID. We undertook both quantitative and qualitative research to understand the situation in terms of broadband. We created short-term immediate strategies for pandemic response, and we used this as a guidepost. One was that it was immediate. The second was that it should not adversely impact the long-term goal of the state to get to 100 megabits per second over 100 megabits per second speeds in the state. And it should be, this work should assist in driving towards long-term state goals whenever possible, understanding that this is a project that was funded specifically to address the immediate, and I mean now, COVID-19 needs. These recommendations assume financial and staff resources can act quickly, and we think these are things that are actionable right away. And you know, because of the short timeline that we had to put this together, and the desire to get feedback on this preliminary draft, some of the recommendations will be detailed in the final submission. But to be very clear, and we put this in bold for a reason, this is not the 10-year telecom plan or a blueprint to bring the state to over 100 megabits per second by 2024, which is the stated goal of the state. Again, this is focused on making sure that people are connected in this moment of a unique pandemic. So over the course of the last couple months, we did a lot of outreach. We did interviews with over 63 stakeholders across public and private sectors. We did an online residential survey with 4,000 responses. We did an online business survey with over 400 responses. We did a phone-based residential survey targeting underserved premises. That was done by taking the premises that were understood to be underserved by the definition in the state and then doing a random sampling of those and a 200 person telephone survey using random responses, which we think we can extrapolate some findings out of. And then online surveys with core stakeholders, including librarians, superintendents, and town managers. And we were incredibly grateful to the Librarians Association, the Superintendents Association, the Vermont League of Cities and Towns for assisting in making sure that we heard from stakeholders in those areas. So our summary of findings are that the real challenges are with residential connectivity, not with institutional connectivity. We divided the folks who were facing that challenge into 3 buckets. One was being unserved due to an infrastructure challenge, the other being unserved due to an income challenge, not being able to afford broadband even though they had infrastructure available, and then those who are unserved due to both. There is clearly an intense need for connectivity for remote work, remote education, and telehealth. And we believe from the research that we did that using temporary cellular data infrastructure, we can get to over 90% connectivity for short-term needs. In order to do this, however, we need to mobilize people quickly to help implement, and that the stakeholders that we talk to, including CUDs, have an important role to play in making this happen. So this graphic is to help illustrate the universe of Vermonters that we are trying to address their connectivity issues. So there are approximately 61,000 premises without access to 25 megabits over 3 megabit per second connectivity. That's our latest the latest data that we had available to us. We also have a significant number of Vermonters that have that are challenged on income, and that can be put into a few different buckets, including the nearly 70,000 Vermonters who receive benefits from 3 Squares VT. And we believe, in a broad look at it, that means there are approximately 13,000 to 22,000 premises where there are people who are low income and are unserved that are in that intersection. And these are the universe of folks that we are focused on with these recommendations. So the surveys told us a few different things. On the education side, I think no surprise that there was a lot more people using remote learning, but that teachers are spending a significant amount of time working out at-home technical issues for themselves and for students. Some districts have seen absenteeism increase pretty significantly, and that there are a lot of students that don't have access to broadband, that are sitting in school parking lots and outside of other Wi-Fi enabled buildings in order to participate in the baseline of education, not the after school, just what they are needing to take for school. And we have some interesting notes on the challenges that students are facing from the survey results on being able to get adequate broadband at home to do this work. In addition, we heard from businesses about the challenges that they are facing, and they've almost 40% of the businesses who responded said that they were experiencing the impact of inadequate broadband at the business location, employees' homes, or customer homes. Now, it's a broad swath, right? But it's saying that the activity of business in the state is being impacted under COVID by lack of connectivity. We also talked to folks in the telehealth space and got some, some really robust feedback. But what was most striking to us was the incredible growth in using telehealth that we received from the survey results that we got, where you went from having 81% of the respondents had never used telehealth before the pandemic, and that shrunk to 25%. Only 25% that are never using telehealth during the pandemic. So this is just a monumental shift. It's not too surprising, although the shift in this kind of magnitude that we saw, at least from the online survey that we received, is substantial, and I think sets a new paradigm, but clearly the need to be able to connect. The other thing that we heard that was significant in this area was that healthcare providers, doctors who were trying to continue to practice while in quarantine or from their home, found it was difficult to be able to participate because of their lack of strong broadband. The other universe of folks that we surveyed directly were town managers across the state. They did report, as they were going to more and more online forms of democratic participation, that they were struggling to understand constituents who are trying to share their views in public meetings because of the poor service that was available at the home. The other piece that is a little bit more forward-thinking, but we figured we would survey, is how many of the towns have started to plan for an online town meeting in the event the pandemic could continue. We felt that was an important measure of just how folks at the municipal level are thinking about this, and 60% said they had not started planning for that. So I think that is a clear indicator that there's going to have to be some ongoing education and making sure that folks know how to be connected. What we did find is that for the most part, state agencies and government systems have been resilient and have stepped up to the challenge to be able to engage with people in a more online capacity. But there are still some challenges out there in that core infrastructure that's available, particularly out in the regional and local enterprises who are trying to continue to provide support. And the Regional Development Corporation said that they are spending a lot of time providing technical assistance to businesses with some funding that they have received to do so, but the demand has far outpaced that funding. And then there's some big challenges, particularly for towns that are having to figure out how to engage in the democratic process with the current infrastructure that's available to their constituents and citizens. And there is sometimes high friction in the programs that are trying to address telecom challenges. And unfortunately, that means that there has been lower adoption than one would want to see. Community institutions have also adapted to support for monitors. Libraries are doing a lot of work in a lot of interesting ways. Although only 2 libraries are lending mobile hotspots, which is interesting since that's an area we've seen in other parts of the country happening a lot. The public access television have been doing a lot of different and creative work to be able to make sure that people have access to municipal functions and be able to see it online. They've even been doing coaching for other civic institutions to be able to continue their activities. Superintendents are really concerned about the lack of universal broadband leading to a differential in who's able to access an equitable education, especially as some have had to go to all remote, off and on in unpredictable ways. And the CUDs have been working hard to be able to create pathways to make sure that there is connectivity, and they continue to have a strong desire to support all people, whether they are served or unserved, to be able to get connections. So we did talk to the current ISPs, and we have also talked to people who have tried to work with ISPs to be able to get additional connectivity. And as you can probably imagine, the different kinds of programs have been utilized at different levels. Some of the independent networks have just been providing free service to low-income subscribers in a variety of different circumstances. They have reported that there is a 30% increase in bandwidth usage, which is a lot on a system. DSL is particularly constrained because of the way that the technology is structured. And we have also seen that the low-cost programs offered by Comcast and Charter have had low adoption rates. And the chart on the right comes from the survey that we received from people who had self-identified as low income. And it showed that only 10% of those who responded to that survey had actually successfully signed up for the Comcast program for low-income residents that has been bolstered during the pandemic. So there's a lot of, and 59% had not even heard of the program. So there's a lot of potential there to be able to connect. There are still some significant challenges. Almost 61,000 premises are still underserved. Low-income Vermonters are disproportionately unable to access broadband connections. Again, the low adoption is having a real impact for low-income Vermonters. And there's technology and digital literacy barriers for the folks who have been asked to change their practices across the board. And it's meaning that people are spending a lot more time trying to solve for these connectivity problems. And there is still not the staff to be able to address those connectivity issues, at the local level, at the regional level, or at the state level. So we are recommending, 3 big strategies to mitigate this situation in this short term. The first is to provide a new broadband service subsidy to low-income Vermonters during the pandemic. We want to be clear, we know that there is a program that was set up by the Department of Public Service to try to address this, but there hasn't been a significant take rate on that program. And we believe from looking at other programs in other states that there are ways that that could be, we could have a much higher take rate across the board with a somewhat different strategy. We strongly believe that we can connect a lot of the underserved with 4G mobile hotspots, and in some cases signal boosters for folks who do not have enough of a cell service at their home. And that it's going to take a lot of folks to actually do this work and work with individuals to be able to either take advantage of subsidized programs that are already available to those who have infrastructure, and to get these mobile hotspots deployed and assess when signal boosters will make a difference. And to do that, we would recommend launching as quickly as possible a broadband core that could help to support this effort. The work that needs to be done is not super high skill in nature. And we believe that that kind of a core structure, engaging people to go out and do that just labor-intensive work would be very effective. So I'm going to, in the interest of time, go through these, at a very high level, and we welcome comments. There's a lot more detail in the plan itself, but we do believe that a broadband subsidy program similar to what has been done in places like Alabama and Delaware, where you aggregate at a statewide level the essentially purchasing of connection codes or other kinds of devices to connect, and then are able to work directly with consumers to be able to get that benefit would move things a lot faster. We have some recommendations on eligibility, and we believe that there are some good models to be able to work with. We do think that there are places where fixed networks and mobile hotspots can be deployed in conjunction with the next recommendation, but you can also do subsidies that are associated with those. The second area is to just get additional targeted equipment and infrastructure to reach the currently unserved. That includes mobile cellular data hotspots and devices where there is not enough signal to actually provide signal boosters, which are small antenna that typically go on the outside of a home where there is poor but existing cell service. And finally, doing line extensions in places where there are pockets of unserved premises, and they're completely surrounded by existing wired service. These are places that are unlikely to be a priority for CUDs and others, and a targeted line extension program could get those individuals covered, and we think quickly. We used a lot of data through geospatial analysis to be able to, on a iterative basis, get to the total number of people who are currently unserved. And then we also looked at the kinds of expansion in wireless that is coming from AT&T under the FirstNet expansions. And this is the driving reason that we believe that a mobile data hotspot device strategy would be effective. And we do have these maps and data in the larger report so that you can see how we worked through looking at all the places. And we went through this reductive analysis looking at the ways that we could address the connectivity issues. And the blue line is the total unserved now. And then each of these steps represent another way that we could fill that gap to the point where we get just about everyone totally served. And we would look at other creative ways to try to bridge to those last few locations. The pockets, this is a little bit more on the pockets that we think line extensions make sense. Again, these are, as you can see in the green circles, these are places that have all around plenty of connectivity, but the targeting of line extensions to those specific locations could solve those islands of unserved and make sure that they have the infrastructure they need during the pandemic. The broadband core is the way to actually get this done and get this done quickly. We have, an estimate that we would need 42 core members that could get started before the end of the year if there was the will to get this rolling, but that they would be working in collaboration with the regional planning commissions who have taken a lot of the lead on the CUDs, and coordinate closely with the CUDs who have already shown to provide a lot of incredible volunteer energy and expertise and passion about their regions. Not every community is in a CUD, so you'd want to make sure that the planning commissions are involved as well to fill those gaps. And they would be out there doing the field work and testing to ensure that proposed solutions work on the locations, testing if it would work for cell service with an antenna or something else. They could assist with installations and on-site troubleshooting, and then provide a help desk for Vermonters to call with connectivity issues to be able to address those problems that come up, particularly for households that aren't as sophisticated with telecommunications because they haven't had to be, and make sure that they are connected as well as are able to take advantage of some of the subsidy programs that we've been talking about. Here is the summary of the cost estimates to do this. It is not a small amount of money, but it is it's realistic. You wanted to make sure that the individuals who have access to infrastructure but are low income have K-12 students, that you make sure that they have service. It's going to be $7 million for the next year, and so that's what we estimate as the cost, and then an additional 2.4 million for those that don't have infrastructure to make sure that they have the mobile data hotspots. We believe there are 39 towns that are well suited for line extensions to fill those islands or pockets, and that we estimate around $5.6 million. Booster antennas for peak cell service, but could still benefit from mobile data devices is about $500,000. And then the broadband core, depending on how you structure it, would be 1.2 million to 1.5 million. It could transition into an AmeriCorps program or leverage National Community Conservation Corps members to get over some of these intense work infrastructure pieces. But that's a summary of the cost. And that's an overview of the draft recommendations and analysis, and look forward to feedback.
Great, Matt. Thank you very much. Appreciate it. Really like that last slide. All right, that was a joke. I'm sorry. Let's turn it over to public comment. Just to refresh how this will work, I'll go over how we're going to handle public comments again. Remember that you're being recorded, and that we will post the recording at the conclusion of the hearing. Please keep your comment to 5 minutes. And at the end of this proceeding, if you really want to say something again, we'll try to fit you in. If we can't, please attend the next hearing on December 8th or follow up with us in writing. You can also post your comment on our website. We're here to discuss the substance of the plan, so the things that Matt talked about, things that are in the plan. We'll be keeping you on mute when you're not speaking. Please keep yourself on mute so that we don't interrupt folks who are speaking. We're going to go in the following order. We're going to start with people who have joined by video. So if you are using the Teams meeting program, please raise your hand. We're going to start with you all. Once we're done, we're going to move on to folks who've called in and who have emailed us with their intent to speak. And we'll have a list of those folks after we're done with the video folks. And then at the very end, we try our best to accommodate folks who've called in but were unable to email us. And I think that's it. So let's open it up for public comment. If you have one, please raise your hand. And the raise your hand feature is in the toolbar at the top. All right. All right, let's start with FX Flynn. And FX, you should be able to unmute yourself.
Yes, hi. Thank you very much. I appreciate the opportunity to offer public comments. And Matt, thank you very much for putting this together. I think you've focused on a lot of the most important things that are in front of us during this pandemic. I think that that you and other folks in the state are probably aware of this, but I'd like to publicly announce that that EC Fiber has begun an effort to set up a 501c3 that will allow us to provide subsidies for families with students. What we have learned in trying to understand how we can support economically challenged households and their broadband needs is that it's a very difficult area to navigate and to make connections with those families and to get them set up in a way that is respectful of their privacy and also attentive to their needs. And a lot of the things in your plan make it clear that you understand this as well. So I would also say that it would be it's kind of fundamental to our notion that at some point there will be government subsidies as well, because right now the broadband lifeline program does not even begin to scratch the surface of what's really required, in terms of subsidizing these folks. So with that said, very happy also with the attention that you've provided the CUDs, which is really the only proven model for pushing world-class broadband out into the rural areas of Vermont. And thank you very much for this opportunity.
Great, thank you.
Clay, if I could just, one thing that I missed, and FX, thank you for the remarks, but I also forgot to introduce my colleagues who are on the line and were key to making this happen. And they include Alex Kelly, who's from Rural Innovation Strategies, as well as Joanne Hovis from CTC, who is the lead on developing this and has done this kind of work in other parts of the country and was core and central in the driver of this set of recommendations. So I meant to do that at the very top, but wanted to do so now.
Great, thank you, Matt. Let's move on. I am not seeing anyone else with their hand raised who's joined by video. I'm going to ask again if you would like to join the conversation and give a comment. And you can't find that feature. Please unmute yourself and say you would like to speak, and we'll try to fit you in. Going once, going twice. Okay. All right, we will move to the next group of folks, those who have called in and have emailed their intent to speak. Looks like I have at least one person and maybe a second one. I just want to make sure that is Cedric here? Wants to speak. Okay, then we'll move on. The second person is Stephen Whitaker. So *6 to unmute yourself.
Yeah, there's quite a delay when you mute and unmute to get the little robot voice. Steve Whitaker from Montpelier. I I snickered when you said we're willing to take compliments on the plan. I have critiques of the draft plan. The data speeds that are recommended, the solution of using mobile Wi-Fi type devices from Verizon and AT&T, those speeds are not anywhere adequate for what we're trying to do, what students and remote workers and telehealth customers require. So the idea of further congesting our 4G networks with inadequate speeds as a band-aid solution really is absurd, especially in light of the dearth of cell coverage in many areas of Vermont. I mean, there's no recommendation in here that we actually even map coverage, which has been a requirement in statute, finance allowing. I think for the money that was spent on this almost useless draft plan, we could have done a statewide mobile wireless coverage survey, measured survey. So I call to there's no emphasis in this plan or draft plan on use of fixed wireless, how quickly it's deployed, what experience the department must have some feedback now on how rapidly Cloud Alliance and Luke Beaubien and Detail Wireless have completed their fixed wireless solutions, which reach far greater numbers of people with greater speeds, with actually federally recognized broadband speeds. And that's not even mentioned in this plan as a solution, which I think it's a travesty, because even if the vaccine rolls out, we're still likely at least 3/4 of a year of still distance learning and remote work, if not longer. So we're in the middle of an emergency, and we've got very little in the way of action steps. I've bought one of these Verizon MiFi devices, and I quickly hit a cap, and it was $6 or more per gigabyte above that, even more. So the cost factors of using AT&T and Verizon's mobile wireless networks make that really an absurd suggestion. The legal analysis chapter is missing, and it was due on November 16th, and I am quite unable to provide meaningful comments on this plan in the absence of one of the core chapters of it. How that was allowed to not be delivered on November 16th under contract, and how it's still not delivered today is a serious question. The proprietary data, the plan doesn't address the issue of the carriers wanting to keep their coverage information secret or their fiber location secret. The plan punts on access of neutral host and open access and says, oh, that's not going to be in the plan. Put that in the 10-year plan. It's not here. We're not going to deal with it here. But yet you go back and look at the proposal that was made, and they sure did promise to address. I mean, I've actually gone and inserted what was promised in the proposal for what's delivered, and it doesn't add up. But when I talk to CUD people and about fixed wireless deployments being the most rapid, these little $15,000, 4G LTE BRS capable hot wireless, fixed wireless transmitters, they need to be backhauled with fiber. And there's no discussion of whether if open access is abundant dark fiber unused right now were made available, even on an emergency basis, we would be able to quickly put in, even hundreds, 200, 300. There's a full plan for this having already been done for CV Fiber by a professional engineering firm. There's no mention of this no mention of the pole inventory and its role in locating hotspots, where the poles are with 120 volts accessible, or whether we can get streetlight rates to quickly put these in. We're in an emergency, people, and we're dancing about the edges or fiddling. Cable line extensions is another absurd suggestion as a solution. They violate both state goals and state policy in 4 areas: competitive choice, open access, not soon outmoded, and 100 minimum speeds. So to be continuing to advocate for cable line extensions when they go right against our state policy, statutory policies and goals is, again, misguided in the best of yeah, I think I've covered most of it. Without cell coverage mapping, without fixed wireless analysis, without open access to existing fiber. Your numbers in the plan in the slide deck I just saw exclude newly served. Are those newly served or those newly aspiring to be served? How many of those projects that were funded out of the $12 million have gone online or even will go online? And how many will fumble? And so to basically presume those people are already served without any validation, test validation, is again misrepresenting the challenge here. Anyway, that's
Great.
enough.
Thank you, Stephen. I noticed a few additional folks joined while we're taking comments. So if yeah,
Joanne, I think would like to just make a couple of comments. I know this isn't necessarily back.
You want to wait till the end, Joanne, or?
If I can just say really briefly, Clay, and thanks, I appreciate the opportunity to just briefly speak, and thanks to you for a real pleasure working with you throughout this process. The plan is a plan that addresses the immediate emergency and the timeline projected for the COVID-19 epidemic. It does not recommend, per the terms of its scope, strategies that would take years as far as deployment goes, because those would be outside the framework of a short to medium term pandemic. It rather addresses things that can be done in the immediate timeline to alleviate the immediate crisis. And I just wanted to point that out. Matt made that point very clear at the beginning of the effort. So for all our wishful thinking about being able to address all issues and all matters at one time, it is a completely different thing to plan for the long term and to address immediate needs in the relative short term.
Right.
One last thought on the legal work. I am the person who designed the project plan and the project strategy for this effort. The legal effort is designed to comment on the recommendations made in the plan, to advise as to the legal framework, both in federal and state law, with regard to the recommendations made in the plan. Those recommendations have not been finalized because they will be revised in light of comments received today as appropriate, and the legal analysis will then follow. Very much, Clay. Appreciate it.
All right, thank you. Yeah, thank you, Joanne, for that. We'll get back to public comment. I want to make sure that everyone gets an opportunity to speak. Your comments will be taken under advisement and will be used to finalize the plan, which is due December 20. So we want to make sure that we get your comment, and will not necessarily answer all of the points today or questions posed, but we will make sure that that they are addressed in the final plan. I noticed that a few additional people had joined during some of the last comments. So I do want to make sure that we go back and ask if anyone who's joined by video would like to give a public comment. Great, thank you. So anyone who is on the phone who hasn't given a comment that would like to, please unmute yourself and speak. Tell us that you would like to talk. Remember, it's *6 to unmute yourself. All right. Well, thank you very much. I think if no one else, I'm going to make one last offer. If no one else would like to give a public comment, I think we will close this proceeding, and we would invite you, if you want to make a comment, to follow up in writing. We have on our website, if you go to the Public Service Department website, there's a web page devoted to this plan where we will take public comment. You can email us your public comment, psd.telecom@vermont.gov if you would like, or you can join us on December 8th at 6 o'clock. Meeting information is on our website, and we'll have another forum just like this where you can provide public comments. I want to thank everyone who's participated today and have a good afternoon.
Thank you, everyone.
Bye-bye.